Good morning, ma'am. I am Marvin Batasinin from the BSRT3P, and today I will be performing the checking of vital signs. So in checking of vital signs, there are clinical measurements, and this includes the temperature, the pulse, the respiration, and the blood pressure. Before we are going to start the procedure, let me introduce to you first the equipments or the materials that a respiratory therapist or a nurse must have. And this includes stethoscope, thermometer, sphygmomanometer, cotton balls with water, dry cotton balls, tissue paper, waste receptacle for our garbages, jot down notebook, and pen. So now let us begin. So in checking of temperature, so the first thing that we must do is that read the chart to obtain necessary data. Next is wash hands to deter the spread of microorganisms. Next, determine any previous activity that would interfere with accuracy of temperature measurement. Smoking or oral intake of foods or fluids can cause false temperature reading. Next, bring the tray to the bedside and explain the procedure to the patient. When the patient knows what is to be done, he will cooperate better. Tok, 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 tok. Good morning, sir. I am Marvin Batasinin, your respiratory therapist for today. May I know your name?
Yes, I'm Christopher Letonwa.
How about your birth date, sir?
It's June 22.
Sir, are you aware that I'll be checking your vital signs this morning?
Yes.
Sir, I have some questions. When was the last time of your intake?
It was an hour ago.
Did you drink any caffeinated drinks?
No, I didn't.
How about smoking, sir?
No.
Okay. Next is rinse the thermometer by using cotton balls with water in a firm twisting motion from the bulb to the stem, and then dry using same motion using dry cotton balls or clean soft tissues. Chemical solutions may irritate the mucous membrane and may have an objectionable odor or taste. Cotton balls or soft tissues will approximate the surface, and twisting helps to come in contact with the thermometer's entire surface. Next, expose the arm and shoulder by removing the sleeve of the client's gown. Avoid exposing chest. Sir, excuse me, sir. May I remove your sleeve, sir?
Yes.
Next, pat the patient's axilla dry with a washcloth or tissue. Place the probe of the thermometer into the center of the axilla. Bring the patient arm down close to his body and place his forearm over his chest. Moisture in the axilla may alter the result of the temperature. The deepest area of the axilla provides the most accurate temperature measurement. Sir, this time we need to clean your underarm.
Okay.
Would you allow me to clean it for you, sir, or you will be the one to clean it by yourself?
I'll just clean it by myself.
Here you go, sir. Okay, sir, mag-start na ako, sir. Next, leave the thermometer in the place until signal or beep is heard, or 1 to 3 minutes of ordinary thermometer. So we've already heard the beep of the thermometer. So now, the next step is remove, dry with tissue paper, and read measurement on digital display of the thermometer. Sir, tanggalin ko na sir ha. So in cleaning the thermometer, we should first clean the stem to the bulb, because according to the concept of the cleaning of thermometer, it should be you should clean the thermometer from less contaminated area to the more contaminated area. Sir, based on the thermometer's reading, you have 36.7 degrees Celsius. So, you have no fever, sir, and normal lang yung temperature niya ngayon. Thank you. Next, inform client of temperature reading, allowing sufficient time for the axillary tissue to come in contact with the thermometer bulb results in a reasonably accurate measurement of body temperature. Next, assist client in putting back the sleeve of gown. Sir, ibalik ko na sir ha.
Sige po.
Next, record reading in the jot down notebook. Report anything unusual. Next, wash hands, and lastly, document the data. Next, I'll be doing the checking of pulse of the patient. So the first thing that I'll be doing is explain the procedure to the patient to gain cooperation and make the client at ease. Next, have the patient rest his arm alongside his body with the wrist extended and the palm downward, or place the arm on the top of the patient's upper abdomen with the palm down position. This position places the radial artery on the inner aspect of the patient's wrist. The respiratory therapist fingers rest conveniently on the artery with the thumb in a position to the outer aspect of the patient's wrist. Next, place your first, second, third fingers along the radial artery and press gently against the radius. Rest the thumb on the back of the patient's wrist. The fingertips, which are sensitive to touch, will feel the pulsation of the patient's radial artery. If the thumb is used to palpate the patient's pulse, the respiratory therapist may feel their pulse. Next, apply enough pressure so that the patient's pulsating artery can be felt distinctly. Moderate pressure allows the respiratory therapist to feel the superficial artery to expand and contract with each heartbeat. Next, using a watch with the second hand, count the number of pulsations felt for 1 full minute. Sufficient time is necessary to detect irregularities or other defects. Next, if the pulse rate is abnormal in any way, repeat the counting to determine accurately the rate, the quality, and the volume. When the pulse is abnormal, longer counting and palpation are necessary to identify most accurately the unusual characteristics of the pulse. Next, record pulse rate on the jot down notebook. Next, refer to anything unusual. And lastly, document the data. Sir, good morning, sir. Ngayon,
Good morning.
I'll be checking your pulse this time.
Okay.
So, okay lang po ba kayo, sir? Sir, kunin ko muna yung arm niyo po, sir, ha? Ano na po, sir? sir.
Yes, sir, welcome.
Sir, as I was checking your pulse, normal lang po yung result.
Okay. Thanks God.
Now, let us proceed to the respiration. So, in respiration, it is the exchange of oxygen and carbon dioxide between the atmosphere and body cells and is initiated by the act of breathing. So, the first thing that we must do in respiration is that while the fingertips are still in place after counting the radial pulse rate, observe the patient's respiration. Counting the respiration while presumably still counting the pulse keeps the client from becoming conscious of his breathing, which can alter his usual rate. Next, note the rise and fall of the patient's chest with each inspiration and expiration. This observation can be made without disturbing the patient's bedclothes. A complete cycle of inspiration and expiration consultants are one act of respiration. Next, using a watch with the second hand, count the number of respiration for 1 full minute. Sufficient time is necessary to observe rate, depth, and other characteristics. Next, if respirations are abnormal, repeat to determine accurately the rate, the characteristics of the breathing. Next, record the respiratory rate on the jot-down notebook, including abnormalities in rhythm and depth if any. Next, refer to any abnormalities in rate and or rhythm. And lastly, document the data. As I was checking the pulse of the patient, I was also observing the respiration of the patient. Sir, based on the respiration, you have 17 CPM or cycles per minute.
Okay, sige. Thank you.
Now let us proceed for the blood pressure. So blood pressure, it is the lateral force exerted by the blood on the arterial walls. So the first thing that we must do is that explain the procedure to the patient. Make sure that the client has not smoked, cigarette, or ingested beverages that contains caffeine within 30 minutes. Nicotine causes vasoconstriction in peripheral and coronary blood vessels, which may cause an increase in blood pressure. Caffeine is a stimulant that increases blood pressure. Sir, now mag-check lang ako ng blood pressure ninyo, sir.
Okay.
When was your last intake, sir?
It was 30 minutes.
Okay, did you drink any caffeinated drinks?
No, not really.
How about smoking, sir? Okay. Next step, place the patient in a comfortable position with the forearm supported and the palm upward. This position exposes the brachial artery so that the stethoscope can rest on it conveniently on the antecubital area. Sir, mag-start na po ako, sir.
Okay, sige.
Position lang po tayo, sir, ha? Konti.
Okay.
Next, position yourself so that the calibration of the apparatus can be read at eye and level and no more than 3 feet away. An accurate reading is obtained when the manometer column is in direct vision. Next, place the cuff so that the inflatable bag is centered and lies midway over the anterior surface of the brachial artery, should be at the center of the two tubings of the cuff so that the lower edge of the cuff is 2.5 to 5 cm above the antecubital fossa. Pressure applied directly to the artery will yield the most accurate readings. Sir, mag-start na ako, sir.
Yes, sige.
Next, wrap the cuff smoothly and snugly around the arm with the end of the cuff secure. A twisted cuff and wrapping could produce inaccurate reading. Next, use the fingertips to feel a strong pulsation on the antecubital space. An accurate blood pressure reading is possible when the stethoscope is directly over the artery. Next, inflate the cuff to 30 mm mercury where the pulsation disappears. Place the diaphragm of the stethoscope directly over the pulse. This will prevent you from missing the first tap sound as a result of the auscultatory gap, a period where no sound is heard. Next, gradually deflate cuff all the way to 0, taking note of the first and the last clear, loud sound. The first sound is the systolic BP and the last sound is the diastolic BP. Next, remove the cuff and make the patient comfortable. Next, record the reading on the jot-down notebook. Next, report anything unusual. And lastly, document the data. Sir, relax lang ka, sir. Ibalik lang ka sa application na ka, sir.
Okay.
Sir, based sa blood pressure niyo po, sir, is 120/80. So far is normal lang po lahat ng vital signs niyo po.
Okay, thank you.
That's all for today, ma'am. Thank you and God bless.